So you're trying to understand Medicare, and it can be really confusing. Like, when do you start thinking about applying? Well, if you're coming up on the age of 65, it's time. If you're like a lot of us and retiring later, you're ready as soon as you no longer have employer health insurance. Maybe you already have a Medicare plan, but you're thinking about switching it up. No matter what's going on, you need to know some basics. So let's get started. Medicare has 4 parts: A, B, C, and, yes, D. Then there's this 5th part called supplemental insurance. We'll get back to that. But what do these parts and letters mean? Well, Part A is for hospital visits, and you get it just by signing up for Medicare. For most people, you get Part A automatically, and it costs absolutely nothing. Parts B, C, and D, on the other hand, are optional. If you want those, you have to pay for them. Part B is for doctor's visits, things like routine physicals, blood pressure checks, and tests that they might do, things like that. And Part C? Well, let's say you want to add eye care or dental coverage or something else. Well, that's where Part C comes in. It's also called Medicare Advantage, and it's pretty comprehensive. Part C combines Parts A and B, along with some of the other coverages you may need. Then, of course, there's Part D. Part D is prescription drug coverage. You can purchase it on its own, or you can combine it with Part C in one neat little package. You can also buy a supplemental policy if you want. They're called supplemental because they cover some of the costs not included in Part A or Part B. And there you are. Those are the basics of Medicare. To find out more, visit our website at seniorhealthpro.net or give us a call for a free evaluation and recommendation.